Okay, we're on.
Welcome, everybody. Welcome to this live stream during the annual enrollment period. We are excited to be with you. The topic for today's video is going to be the average cost of Medicare supplemental plans across the United States. So, done a little bit of research on this. We want to talk about the differences between Plan G and Plan N and probably Plan F. There's some people on here who are watching who have a Plan F, and so we just want to talk to you guys about the differences. We know that there's inflation out there, and that one of our goals here is to make sure no one's struggling to afford their insurance. So we're going to talk about the differences between these supplemental plans. We're also going to show you how you can get a quote for yourself, just to compare the plan options that are available in your area based upon your age and whether or not you smoke and what your gender is. So we're going to make it really easy for you guys to be able to do that. And then, of course, we're here for about usually between 60 and 90 minutes just answering your questions. And so we're excited to spend some time with you guys tonight. So anything that is Medicare related or Social Security related, whether it's about an Advantage plan, a drug plan, a supplemental plan, we will do our best to answer your question concisely and truthfully and accurately as well. So go ahead at any time. You can put a question in the chat and we'll be happy to get to them. Before we get started, please tell us where you're tuning in from. Okay, we are in Overland Park, Kansas, which is a suburb of Kansas City, and it's where our headquarters is. We've got a team of about 100 people here that every day come to work just excited to help people with their Medicare things. So tell us where you're from, please, in the chat, and then we will get started very shortly. Okay, I'm seeing Central New Jersey, Wisconsin, Louisiana, welcome. Massachusetts, Texas, Shelley, Maryland, Massachusetts, Western Minnesota, Scott, welcome. Kay from Nebraska, Jeff from Virginia, Barbara from somewhere. It's going too fast. Awesome. Love to see all this. Hey guys, my name is Josh Music. This is my dad, Marvin Music. Most of you guys know him, I'm sure, from watching some of his other videos. But we've been working together for almost 15 years, and we started this company called MedicareSchool.com, and we started it with the desire to educate people. We felt like everyone was getting sold a plan without understanding it. So we said, hey, what if we just reverse this whole thing, and let's just start with education and make sure that everybody understands what Medicare plan they're getting so that they can really get truly the best coverage. So if you need assistance at any point, you can call the phone number that's scrolling along the bottom of the screen, which is 833-833-3661. We've got, again, a team of about 100 people that would love to help you this year with your Medicare coverage, making sure that if you have a plan that needs an upgrade going into next year, or you have a plan that got dropped, or you just want to save some money, or maybe this is your first time going on Medicare, we'd love to be able to assist you. You can call us. Our services are free to you, and we would love to assist you. So without further ado, let's get into the average cost of supplemental plans across the United States.
All right, very good. Thanks, Josh. We're going to talk tonight about really the top 3 plans in the country. Right now, there are actually 10 different supplemental plans. Those of you that are starting Medicare after 1/1/2020 could actually buy 8 of those. If you started Medicare before 1/1/2020, you could still be a part of the 10 different ones. But of all the plans available, the great majority, I'd say probably 95 to 97% of all people today are getting one of 3 plans, either an F plan, a G plan, or an N plan. Now, those of you that may be new to Medicare, the reason people buy supplemental plans is because Medicare doesn't cover anything 100% other than preventive services. So when we stay in the traditional original Medicare system, there's always going to be a financial liability, responsibility you have, and we call those gaps. And so when we talk about Medicare supplemental plans, they're also called Medigaps because you're buying this plan that's represented by a letter that's going to fill in the financial gaps that Medicare did not cover 100%. And so the plan that gives you full coverage is called the Plan F. Full coverage meaning it covers all 6 of the 6 Medicare gaps. There's 3 gaps on the A, 3 gaps on the B, but that F plan will cover all the gaps. So when someone sees a Medicare provider gets a service covered by Medicare, they should never see any bill beyond the F premium. Again, that's the plan, though, that many of you can't get because you're starting Medicare after 1/1/2020. So if you started Medicare after 1/1/2020, the most comprehensive plan on the market available today is the G plan. And the G plan covers 5 of the Medicare 6 gaps. So the one gap you'd be responsible for if you had a G plan would be the Medicare Part B deductible. This year, that's $240. We don't know yet what it's going to be next year. Medicare has not released the 2025 numbers yet. We anticipate that to happen any day, but not yet. So the G covers 5 of the 6 gaps, and the next plan is the N plan. Again, a popular plan. N plan covers 4 of the Medicare 6 gaps. It will not cover the B deductible, just like the G doesn't, and it will not cover excess charges if and when an excess charge occurs. Excess charges are very rare. Less than 5% of doctors even charge them, but when they do happen, what that means is that's a doctor that will not agree to accept Medicare reimbursement rates as payment in full, so they add to the bill. And when they add to the bill, they add 15%. If that happens and you have an N plan, then you would pay those excess charges. Again, it's pretty rare, but if it did, you're responsible for excess on the N plan, where the G and the F covered that. And then the last thing about the N plan is there's a couple of very reasonable small copays, and that is that we will pay a copay to the doctor for up to $20, and if we went to the emergency room, we have a copay of $50. All right, so those are your top plans. Each of those, of course, have different premiums, so the more coverage we have, the greater the premium. So F is the highest premium, G would be next, and then N would be below that. And we're going to show you some of the averages of these plans throughout the country today. Now, I want to clarify a couple things. When we get a supplemental plan right at 65, we don't have to qualify for that. Let me rephrase that. If we start Medicare at 65 and we're enrolled in A and B, we can initially get a supplemental plan with no underwriting. We call that guaranteed issue. So when you first go on Medicare, we have A and B. We have actually a 12-month window, 6 months before our B date and 6 months after our B date, where we can enroll into a supplemental plan with no underwriting. Now, if you work for 2 more years beyond 65 and then start your Medicare, then that's when that time period would start. We call that the Medigap open enrollment period, tied to your B date, 6 months before and then 6 months after that B date, no underwriting at all. But after we're over that 6-month window in most states, now we have to qualify to get a Medicare supplemental plan. So as we talk about new to Medicare, you don't have to worry about qualifying. But if you're going to, you're beyond those 6 months of B date, then more than likely you're going to have to qualify. Right before I came in here, I met with a retired doctor, anesthesiologist, he and his wife, and they've been on Advantage plans for a couple of years and want to get off of them. Had to medically qualify, and they were in good health, and we were able to get that through. But the point is, if you're going to be switching Medicare supplemental plans that you've been on for a while, more than likely, we're going to have to go through that underwriting process. So just want to make sure you know that that's just kind of part of switching those plans. All right, now, lastly, before we get into these prices across the country, I want to clarify something. When you get a supplemental plan in your area, normally it's going to be based upon your gender. In fact, the doc I just wrote, he and his wife's rate were different by about $17 a month. His was a little bit higher than hers. They were the same age, 67, but the premium was different. So premiums differ based upon gender, differ certainly beyond because of age. And then your zip code, your location is going to determine that. And then if you're a tobacco user, that also can affect the rate. So our rates are based upon gender, age, zip code, location, as well as tobacco. Now, in the majority of states, majority of them, your policy is going to be either what we call an issue age policy or an attained age policy. And I know we get a lot of questions about this, which is better. And the truth is, there's no way to know which is better. And so when an agent says this is better, I guarantee it's because the agent is pushing that kind of a plan because that's what their company sells. Okay, so the difference between issue age and attained age is this. When you get either one of those policies, you're going to pay your initial premium based upon the age that you are. So if I'm 65, I have a certain premium. I have 67, I have a different premium. So our initial premium is based upon our age. But then, how will prices increase? Well, with policies that are issue age, the only way they can increase is if the whole group that you're in goes up. It's a group increase. So my initial rate is age, and then group increases after that. If I have an attained age policy, that rate initially is a little bit lower, but every year when I attain another age, I'm a year older, then my rate's going to go up a little bit. as well as I also could have group increases. And so what happens is issue age normally starts a little higher, attained age a little bit lower. But both of those can still have group increases, and that they will have. Really the key to having rate stability is not attained versus issue. It is getting a supplemental policy with a company that has a good market share of the business, a larger share, because there's more policy holders in that group. And that means the stability of the rate and the risk with that group is spread out to more policy holders. I use a silly illustration, but it's true, and that is this. If I was in the ocean and I was in a canoe, small boat, I'm going to feel every single way. But if I'm in a cruise ship, I'm in a large boat, I hardly even know I'm in the ocean. Why? Well, because that's spread out. So same thing with these groups. If you have a small group and you start getting price increases and there's health problems within that group, you are going to see drastic price increases. You're going to feel the pain of that. If you're in a large group, then you won't feel that as much. And so my point is, it's not whether issue age is better than attained age. It's not true. It is how large is your group, because both of them are going to take group increases. All right. And then lastly, there are some states that are called community rated states. Most of these would be on the East Coast. And these are states that require the insurance company to give everybody that's getting a Medicare Supplemental Plan at that time the same price, regardless of age, regardless of gender. And we call it community rated because everybody gets the same price. So the 70-year-old pays the same as the 65-year-old. The 85-year-old pays the same as the 60-year-old as well. Can never be based upon age. Those are called community. And they too go up. But again, they're going to take a group increase. All right, so enough with that. Let's talk about prices around the country. And again, we're a broker. We write in all 50 states. So we just selected, we went kind of through from the West Coast to the East Coast, selected a few states. Now, I want you to keep this in mind when we look at these rates. These rates are, these would be female rates, a lady that is 65 years old, non-tobacco. Okay, so we know that these rates could vary depending upon gender and age as well. But we want to start here, and then we actually then are going to give you a wonderful tool for you to actually look at these in your own area. So right now what's going on in the market is there are people that are on F plans that are normally, if they can medically qualify, moving to a G plan or an N plan. And both of those decisions would be great. So F to a G or an N. And if you're on an F plan and you can medically qualify, I would strongly recommend that, because you're probably overpaying for the one additional benefit on the F plan, and that's the B deductible. But you're probably paying, $50, $60, maybe $100 more a month for that one small benefit. So I think it's wise to move to a G or to an N plan. Now, there's some people that are on G plans and maybe their money's a little bit tight right now and they would like to save some money, which you could do two things. We may be able to save money moving G to G, or you may want to move from a G to an N plan. Again, you're going to take on a little bit of risk on the N plan, but not very much. And so if you, again, would like to save some additional money, I think moving from a G to an N could be something you at least want to consider. All right, and then if you're on an N plan, maybe your rates have gone up and there may be a better option for you. So again, you can go to our tool to see if there would be a better company and a better plan for you. So that's what's happening. So F to G or N, G to another G, or to a G down to an N. All right, so we'd be happy to talk to you about that. So we're going to go through these together. And again, we're going to start on the West Coast, just talk about California. And again, these are just some average rates for sure, but you can narrow this down to your specific rate with our tool. So you can see in California right now, average right now, California G plans for a lady 65 is going to be about $150. That N plan is going to be about $35 a month less. So we saved what, $420 on the N plan. We're responsible for excess and some copays as well. All right, let's keep going. So Texas, you can see there's again about a $30 difference between that G and the N plan. And by the way, you interrupt anytime you want to. All right, we're good to go. All right, Colorado, we're seeing about a what would that be? No, excuse me, again, about a $35 difference between the two. Illinois, not quite as much difference, just $25 between the G and the N. Ohio, about $40. Now, I want to pause for just a second and talk about Ohio, because it's a state where excess charges cannot be assessed by the physician. So no excess charges in 8 states. Those are Connecticut, Massachusetts, Minnesota, New York, and I'm going to come back to New York in just a second, Ohio, Pennsylvania, Rhode Island, and Vermont. So if you live in those states, those physicians cannot charge excess. Now, you could live in one of those states and then go someplace where you get healthcare services outside the state, then you can still be assessed excess charges. But those eight states cannot charge excess. Now, New York's a little bit of an exception in this. New York has some rules that say certain services, if there is excess, it can never be more than 5%. And there are a few services that could be the full 15%. So we always say New York somewhere between 5 to 15% if it's allowable on a healthcare service. So if you're in a state where you think you'll continue to get only your care there and they don't allow excess, then an in plan may make sense. All right, so let's keep going. Next state is New York. And you can see here now we're talking $65 difference, sometimes even more than that in that state. So now we're saving $130. You're saving about over $700 a year on that plan. And then lastly, two more. South Carolina, and Daniel, I can't see that because I can see my face. There we go. We got about a $30 difference, South Carolina. And then lastly, state of, Florida. There we go. Florida, about $50 a month there. And so you can see anywhere $30 to $50 and up, making that move from the G to an N. And so if you need to save some money, I think that's a very viable possibility. All right? Okay, so
let's remove that and pop it out. Okay, awesome. So I'm going to drop a link here in the chat that you guys are going to be able to go to and pull down a quote for yourself based upon your date of birth and your gender and your zip code. So give me just a second. I'm going to drop this link in the chat. You guys can do this. We'll drop it a few times just so you can go back and get it so you don't have to worry about doing it right this second. But for those of you who are curious, maybe click and open up that in a new tab on your phone and then get back to the YouTube, however you're watching this. We're going to go ahead. So I put the link in the chat there. Let's hop into some questions, and then I can drop that link in a few more times.
Just want to add just a quick comment about this tool. We have this here for you because then you can really check this on your own.
Yeah.
And it's very difficult for you to find this without calling a bunch of different insurance companies, and so that's why we have this. So all the carriers that are in your area that we've vetted will be available. So it's going to be a very, I think, enlightening to kind of see what's going on in your market specifically.
Yeah, check it out. And then, of course, we have let's put the number scrolling along the bottom of the screen just to make sure that stays up. If we can assist you, whether you're a client or not of ours, if we can assist you, you can call that 800 number that's scrolling along the bottom of the screen, and we'll get you to somebody that can help you. Love to do what we can to assist. Okay, let's go through some questions here. If Advantage plans become the default, do you think gap plans, so this is Nanner, if Advantage plans become the default, do you think gap plans will end up going away or be priced out of the market?
Yeah, well, of course, we don't know about being priced out of the market, but I don't think that's going to happen. Obviously, I don't have a crystal ball, but the reason for that is there's just too many within the government that would still like for you to have options. So if we go to Advantage only, there will be no options, and so I don't think that's going to happen. Secondly, gap plans are written for life, guaranteed renewable for life. So yours cannot go away because there's no way the insurance company can cancel it whatsoever. And so being priced out of the market, I don't know. I know there's a lot of speculation on what's going to happen in the future, but I don't see anything really drastically changing with these plans. And by the way, we try to keep our pulse on the market because this is our business. So I think that's a little bit extreme to think they're going to be eliminated. I don't.
Okay, Nanner, another question from you. Husband turned 65 on April 30th. I turned 65 a few weeks later. When should we call in?
Okay, anytime after January 1 would be the right time because your initial enrollment period is 3 months before you turn 65, which is the month of April, and then the month of, and then 3 months after. So that's your 7-month window. So really, January 1. And so what I would do, I'd call an out or go online and set an appointment up, and we can go over everything with you. If you're not on Social Security, you have to enroll into Medicare, and we help people with that every day, all day long. So we're happy to do that and then talk about your plan options.
Yeah, so Nanner, call that 800 number. Just tell them you guys need to start in April-ish, and they'll get you an appointment set up for January. Okay, Valerie Cote maybe says, what's the best supplement for an 89-year-old low-income person?
Okay.
You may, if you're on a supplement already, we'd be happy to see if we can help you switch. You may also consider an Advantage plan. If you're very low income, sometimes those, depending on your market and location, we'd be happy to help you explore that. You can call that 800 number. We've got a team still. They'll be on the phones for about an hour and a half still, being able to schedule appointments. So we really encourage you all to do that.
And if you're low income where you qualify for Medicaid, there's definitely some special plans for you.
Okay, if you become disabled around age 60, what age do they calculate your SSDI?
Okay, the way it works is your SSDI benefit is going to be very similar to what your full retirement age benefit would be. That's the way they do it. So that once you hit your full retirement age, which would probably be 67 in this example, your benefit's not going to go up. Now, it can go up because of cost of living adjustments, but it should be very, very similar to your full retirement age benefit amount.
Okay, Shelley says, if my rates were increasing, would the carrier send me out information in advance stating the changes in coverage and costs?
Exactly, yeah. Usually about 60 days in advance, sometimes 30, they'll notify you of the rate increases.
Yeah, so a lot of people, we get a lot of calls this time of the year where people call us and say, what's my rate going to be for next year? And the answer is we don't know. Most insurance companies don't raise their supplemental plan rates based upon January 1st.
It's not calendar year.
Yeah, it's going to be tied to your birthday or maybe the policy anniversary, and then a lot of carriers take them between April and June. So we don't know what your rate will be for next year because it's probably not increasing January 1st. But you'll always get a notice 30 to 60 days in advance.
And I did see a question about the IRMA, if you can find that. I thought that was a good one.
Well, we'll get there.
Okay, very good.
My state pension is paid 100%. So, Alan Eisenbeck, my state pension is paid 100% premiums on insurance. One of my options going into Medicare is I turn 65 in June 2025.
Okay.
That is typical contribution for pensions. I'm not sure what the question is. Do you?
Ooh, no, I don't. Now, what I would find out for you, Alan, you want to find out because you're going to roll an A and B for sure in that scenario. So in order to get that 100% premium, you need to find out, are they going to direct you to a certain broker, or is that money just set aside, they just pay that to you? So I'd want to find out how you get that reimbursement or that stipend to cover your premiums on your insurance. And if I knew that, I could give you some more information, because we work with a lot of people who do get some stipend. But sometimes they direct you to a certain broker, a certain kind of a company. So love to help, but I need more information.
Okay. If you are making a lateral move from one, so Linda, if you're making a lateral move from one insurer's supplemental plan D to another company's plan D, are you subject to pre-existing condition requirement?
Yes. There are a couple states that you would not be subject to that. Those are called birthday rule states, and there's 12 of those. But all the rest of the states moving from a D to a D. And it's interesting that you have a supplemental plan D, because there are very few carriers that even offer those today. Yeah, for sure. But let's say you do. So if you're moving D to D and even changing companies, you're going to have to medically qualify. Yeah, unless you're in a birthday rule state.
Okay. Lee Rundle says, why are so many drug plans dropping insulin coverage?
Mm-hmm. Well, because what happened when the government put this $2,000 a year cap on the out-of-pocket spending for Part D plans, that put a huge burden on the insurance companies. And so for them to be able to cover that and not lose money, they're changing their formularies. They are dropping insulin and just changing the way those plans are going to work. So I know everyone was real excited about that $2,000 cap, but it came with a price. Because those private insurance companies were not going to absorb that loss at all. So they're adjusting and shifting those plans so they can continue to make money. That's the way it works. It's unfortunate.
Could you talk about your thoughts on the future of Medicare excess charges?
Okay, yeah. Well, I don't anticipate now that we're going to see more doctors charging excess. But I don't know in 5 or 10 years down the road, because we don't know what Medicare will look like. So honestly, I have no idea. Short term, I see no changes. But if they were to make some drastic changes to the Medicare reimbursement rates, some of these doctors may be forced to do that. Most doctors don't do it because it makes their patients mad, and because they'd be responsible for the 15% unless they had a plan to cover that. And then, of course, if someone has an Advantage plan, the excess is not going to occur at all because it can't. So that's enough. I just don't know, but I don't anticipate short-term nothing changing.
Just answered that. So Betsy Sears, I'm not sure of something I heard. If you go to Medicare Advantage, can you go back to straight Medicare?
Okay, yes, you can. And when you do that, though, you're limited. If it's your first year on a Medicare Advantage, in some situations you can go back anytime, but after a year, no way. So they have 2 different times of the year you can move back to original Medicare. That's this time of the year, October 15th through December 7th. And then January 1 to March 31. So we have these 2 different periods where we can get off the Advantage and go back to original Medicare. But when you make that move, when you go back to original Medicare, you're not going to probably just have A and B. You're going to want to get a supplemental plan to fill in the gaps. So again, you'd have to make that move and medically qualify to do so.
Okay. Good evening, Marvin. How often will the cost of my supplement plan increase? Will Part D also keep increasing, and how often?
Okay. Well, supplemental plans are normally going to take an annual adjustment. And that is either a group increase if it's issue age or community, or it could be an attained age increase with a group increase. So I would say once a year. Now, before this last adjustment in 2024, it was not uncommon to somewhere around 5% range, give or take. But because of all the adjustments in medical inflation and people going back to have surgeries and all this after COVID, it was not uncommon for us to see some 10, 12%. Right? That'd be about accurate. So I think those days are over. The 10 and 12%. You had to go through that this year in 2024. But I would expect an annual increase of some nature. But again, if we go with a large group, I don't think they'll be as drastic for sure. And then Part D plans, we'll just have to see. We know that the government put a restriction on the amount of increase. A Part D plan cannot go up any more than $35 premium from year to year. And so we've seen some of those do that. But that's the restriction. But the problem is, even though they are limited $35 increase, they can also change the formulary.
Yep.
And so that's really the most detrimental thing that's happening right now with Part D plans.
Okay, William Gregg says, if you're on a SUP and you use up your $50,000 lifetime benefits for foreign emergency care benefits, can you change to another company and get a new lifetime benefit?
Yes, you can. You sure can. I've seen people do that. So you're in a G plan, you use the $50,000, you change, it would replenish because that benefit is actually tied to that supplemental plan. So yes, you can do so.
My Bruce Rosenfeld, my 87-year-old mom's Advantage plan is no longer being offered in Minnesota, North Dakota. Can she switch to a supplemental plan without any underwriting?
Yes, she can. And when she got her notice saying they were dropping the plan, that letter also told her that she had a guaranteed issue right. So if we submit a Medicare Supplemental Plan for no underwriting, then we also have to submit that letter as well saying this is why we're doing this with no health questions, and they have to approve that plan for sure.
What is the percentage rate a supplement can increase in New York with United Healthcare Plan G?
Well, I did not know that there was a limit to that. I do know that the insurance commissioner in New York has to approve any kind of price increase, but I've never heard of a certain limit. If there is out there, you can put that in the chat because I was not aware of a limit, other than state has to approve it.
Big Bad Bob says, when will the Part B premium for 2025 be officially announced?
We do not know. Everyone's speculating about 185, but we just don't know. We're anxious to hear it.
Here's what you guys need to do. So just about the second that comes out, we'll do a video because there's more than just the Part B premium that changes. There's about 8 numbers that actually change that impact you all. And so what we will do is we'll drop a video on it just right away as soon as those come out. So do me a favor. Everyone, if you're on here, click the subscribe button. If you're watching on YouTube, click subscribe. It's free. And then there's a little bell there. Hit that little bell icon as well. And what that will do is it will notify you when we drop that video, so you'll have not only the Part B, but all the other things that get updated as well. Okay. Let's pop in here. Give me just a minute, guys. Trying to find some other questions. Okay. Aaron Anderson says, are there any plans, SUP or Advantage or standalone vision, that pay some or all of additional costs for premium lenses following cataract surgery?
Okay. All right. Well, if you did have a standalone vision plan, the ones we write are normally through IMED or VSP. And so as far as paying for all the cost, I've never seen that, but either one of those would give you definitely a reduced cost for sure. Oh, you're talking about, oh, my bad, I read it incorrectly. You're talking about you're talking about brand new lenses in your eyes. My bad. So you're talking about upgrading. This is typically after cataract surgery and replacing lenses. I thought you were talking about glasses. So what I just said, scratch it. I know of nothing like that. Medicare and your supplemental plans will only cover the basic lens after during the cataract surgery. So that upgrade, in fact, I've had mine done. It cost me $2,500 to pay for those premium lenses. I thought it was well worth it, but no plan at all. Sorry.
Okay. From Atlanta, Georgia, why does providers have different G plans and prices?
Yeah. Well, because let me quick illustration. If you were to compare homeowners insurance or automobile insurance, all the different carriers have different prices. So that's just the way insurance works. Insurance companies have actuaries, and they have a certain profit margins they're trying to live within. They're also focused on certain markets. There may be a market that they like, and they're very aggressive in a market. Another market they don't care so much about, so their prices may be different. So there's a lot of things that go into that decision, but it's up to the insurance company to set those premiums. So they can set it whatever they want. In fact, I just was told the doctor and his wife, I just wrote, and most of the companies were very, very competitive, but there was one that was real high, and he said, well, why is that? And I said, because that company does not want to write business here. They weren't interested. That's why. It was almost double.
I'm a 100% disabled veteran. I get my drugs from the VA, do all my health needs at the VA. Do I need a plan?
Okay. If I were you and you're very happy with the VA and do everything there, the only thing I would consider if you're enrolled in A and B is to get what we call an MA only plan. MA stands for Medicare Advantage only. There's no prescription drug component. Why? Because you don't need that. And so the reason those are nice is because now at least you have a civilian option. And you can usually get an MA only plan at a zero premium, gives you a civilian option, plus some of the perks that will come along with that the VA does not cover would be something that you could enjoy and benefit from. So those are very attractive plans. Get your meds to the VA and the civilian option. I think most veterans like having that as a possibility. Plus, I don't know how many, I think this year they're still doing some givebacks. Okay, so some of the 2025 plans, when you do MA only, they will give you a Part B reduction. Since they're not having to pay for your meds, they'll give you some of that money back. Sometimes it's $100, $150 on a monthly basis. But call us. We write those plans all over the country, so we can tell you what would be available in your area.
Okay, let's do another question here. Does cataract surgery get paid by A and B, or do you need some kind of eye care plan?
Okay, no. Cataract surgery is covered by original Medicare A and B. It is going to be on an outpatient basis, so it's going to be the B side of Medicare that's going to cover that. You're not hospitalized for it. So that would mean if you didn't have a supplemental plan, you'd be responsible for 20% of the cost of that. And so most people have a supplemental plan, so that supplemental plan is going to pay everything on the G plan except the B deductible. So if you have a G plan and you have cataract surgery this year, it would cost you $240. After that, no additional cost. And again, that would be for the basic lens. Okay, folks, eye care plans are really only for eye exams for eyewear and then eyewear itself, contact lenses and glasses. That's why you get a plan, if you want one.
Vicky Childers says, it is really hard for us to pay for a supplemental plan. We had Mutual of Omaha, GNN, and of course it's going up.
Right. Okay. Well, then what I'd recommend in that case, Vicky, as Josh said in the opening, pardon me?
Yeah, call us.
Yeah, just give us a call and find what I would do. I'd try to find a good Medicare Advantage PPO plan. That way you still got a decent network and you can save money. And really, there's no reason to be insurance poor. If you can't afford that, then I would definitely move to an Advantage.
Okay. Let's see. When do we typically see what our new rates will be for our supplemental plans? Again, we kind of addressed this. It's not tied to January 1st, so you'll just have to wait. And if there's a price increase sometime down the road, you'll get a notice of it.
Usually your policy effective date. So if you start a policy July 1, about 30 to 60 days before July 1, they'll notify you of that price increase. There's exceptions, but that's typically the way it works.
Okay, Catherine Rosenfielder says, if you have insurance through your company, do you still have to qualify?
Okay. No, if you're still working or your spouse is still working and you have an employer-provided plan, I would stay on that plan. Am I interpreting the question right? So stay on the plan. As long as there's
Well,
20
do you
employees
have
on
to qualify?
Yeah.
In other words, probably when you come off.
when you come off. No,
Yeah.
no, you don't have to qualify, but it's not because you're coming off that plan necessarily. It's your B date. So whenever you're retired and you go on Medicare, Medicare gives you 6 months before your B date or 6 months after, where you don't have to qualify for any supplemental plan. You can have what you want. It's called guaranteed issue.
Okay, Dale Smith, can a Medigap insurance plan raise your rates or even drop your insurance due to additional healthcare needs or medications?
Not at all. The only way they can go up is if they take a group increase, or as I said at the opening, if you're in a attained age state, they can raise it up a little bit on an annual basis because of that. But you're never isolated. It's not about your claims. It's all about the group that you're in. So it's going to have to go up because of group.
Okay. If you're on an N or G plan, can you shop around without a penalty every year or two?
Sure you can. Yeah, there's no penalty to do any kind of shopping. In fact, go to our tool that we've talked about and look at those. In fact, when we make application on a new Medicare Supplemental Plan, we don't notify your present company. When we're going through underwriting, we'll notify them after you get approved, but not prior to that. So no penalty, no problems. I think it's wise to do so.
Okay, Kay Banshoff says, I can still get Plan F through BCBS, Blue Cross Blue Shield, due to an agreement. Maybe address those people who have Plan Fs, if they're healthy. Should they be taking them? Should they be switching? I mean, you talked about it a little bit.
Oh, yeah.
A little more urgently.
Yeah, for anyone that's on an F plan, what you have to ask yourself is, how much am I paying for that full coverage plan? Because the next plan below it is almost full coverage. F covers all gaps. G covers all gaps, but the B deductible. So that's only this year $240 for the whole year. So take 240 divided by 12, that's $20. So your F plan, you're probably spending at least 40, 50, maybe more dollars a month for that full coverage plan. And what are you getting out of it? $240 a year. Well, who wants you to do that? The insurance company does. They're happy for you to pay an extra $600 to $1,000 a year for that F plan. When you get a G plan or an M plan, save a tremendous amount of money. So you're overpaying for that benefit. So if you can qualify, I'd get off that thing.
If a senior, Ronald Johnson says, if a senior has talked into switching to an Advantage plan by mistake, can the switch be canceled so they stay on Plan F?
Yeah, well, that can be canceled and usually within the first year of being on that Advantage plan. Sometimes not. That's why we tell people don't make that mistake. But if you've only been on that Advantage plan, you move from the F to the Advantage plan, and you started your Medicare with that F plan, and you're still within that year of moving the Advantage, you can go back. But when you go back, you have to go back to the same company you were with and the same plan, no underwriting. Now, if you medically qualify, you can get a G or an N, but that's called the trial right.
Okay. I am 67 years old. I just started Medicare. What is the difference between Humana Advantage and United Advantage?
Okay. Well, it just depends on the structure of the plan. Number one, are we comparing HMOs, PPOs? So that'd be the first thing I'd look at. I think both of those companies are good companies. They're still going to have very similar restrictions with Advantage. You're still going to have pre-authorizations. You're still going to have networks. So when you compare them, the first thing we do, we want to make sure your providers are in the network. And then we want to look through what will be your out-of-pocket expenses. What's the max out-of-pocket? So it's not really, because both companies are good, I'd want to lay the plans out side by side. I had a lady call me today, one of my clients, and her Advantage plan was canceled. And she wants to stay in Advantage, and so we just shopped and found her a plan very comparable to what she had before. So that's what you want. So give us a call, and we'll lay those side by side and compare the details of those plans. But still, both good companies.
David said, are you seeing large increases this year with all companies? Plan G notified me of a 20% increase. I'm in Nebraska. Plan is going from 158 to 190. That is definitely the largest I've ever heard of. We saw plenty of 10s and 12s. 20, you should shop, guys. You should shop. You should try to see if there's some way to change your plan and save some money.
Yeah.
That would be my suggestion.
Hey, let me add this to this. One of the nice things about, if you've been on a plan for 3, 4, 5 years, when you switch, not only are you probably going to save some money, but more importantly, what you're doing is you're resetting the clock. Because if you've been on a supplemental plan for 5, 6, 7 years, that group you're in is naturally getting smaller. People pass away, people switch plans, people get off, they go to Advantage. There's all kinds of things happening, so that group continues to shrink, and no new money is going in. So as people age, they also get unhealthy. So if you could switch and reset the clock and go in with another company, even if it's just G to G, and you just change carriers, you're going to go into a group that's going to be younger, larger. And so I think the net effect to you is going to be rate stability over the long term by making that switch.
And guys, if we want that link again, you can go to medigapcompare.com, medigapcompare.com, and you will be able to see the rates for your area after you put in your information.
Yeah.
Medigapcompare.com.
It's very, very easy to use. It's really, really great tool.
Okay. Explain the Coopey Protection Plan. Is it different from a hospital indemnity plan?
Yeah, well, they're similar. Copay protections, indemnity plans. Indemnity just simply means that you are paid directly by the insurance company. Typical insurance, the insurance company doesn't pay you; they pay your doctor, your hospital. Indemnity means that you have a health issue that qualifies for a claim. They're going to pay you direct. All right, so when we have a hospital indemnity or a copay protection plan, they come alongside Medicare Advantage plans. You don't have to have one, but I think they're wise to do, especially because we're seeing some really large increases with max out-of-pockets this year. And so if you don't have the money set aside, if you had a serious health issue and your max out-of-pocket is $4,000 or $5,000 or $7,000 or $9,000 on an Advantage plan, and you can't come up with that money, that's the purpose of the copay protection plan. Now, it's not going to cover everything, but it's going to cover your hospital copays, and if you get cancer, then you can actually get a lump sum for a cancer claim, because that, frankly, that's what pushes people usually into the max out-of-pocket. They have a serious health issue, cancer, they're probably going to max out. And what's really sad, folks, we see people maxing out 2 years in a row. You get cancer in September, October, and you get treated, you max out, and then you're still being treated in January, and your Advantage plans reset every year. So then we got to meet that maximum again. So it's very, very troubling. And if you don't have the money, that copay protection is a good way to go. They're usually about $30 a month or so on average.
Okay, Jane Kauser says, how do I know if I have G or N?
Okay.
Well, look at your card.
Yeah, your card should tell you what plan you're on. And also, Jane, if when you go to the doctor, you've been responsible for copays, then that would give you an indication you have an N plan, because on a G plan, you don't have any copays. You have an annual deductible, you're done. N plans, very good plans, but they have a little bit less coverage. So you have copays to go to the doctor as well as the deductible.
Brenda says, Aetna is a great supplemental health plan, and we agree it is.
I agree, it is. Good company, long-term, been very stable with their rates. Good choice.
Mary Ditter says, I'm in Missouri. My current premium is $192. I'm 69-year-old female non-smoker, plan G. Could I do better with a different company? Mary Ditter, what you need to do is go to medigapcompare.com, write that down, go to it after this live stream, and see if there's some better rates for you.
Yeah, you'll see all the companies there.
Okay. Dog Paw says, I am planning on retiring next July when I reach my plan maturity date. I'm currently enrolled in Medicare Part A. My question would be, when is the best time to enroll in Plan B with a supplement?
Okay, so you're going to retire next July, so I'm going to assume that you want your coverage to begin July 1. So back up the clock 3 months. So we're going to back up June, back up May, back up April. So if you're going to do biz with us, we'd be thrilled to do that. Just call sometime in March for an April appointment. 90-day window is perfect in your scenario, because you can't do it way in advance, because we're going to have to help you with your special enrollment paperwork. There's called an L564 and a CMS 40B. Both those documents will help you with all that. We'll fill them out for you, and that will allow you to come into Medicare. So those documents cannot be dated any more than 90 days prior to you starting your Medicare. The Social Security office is not going to process those. So that 90-day window is perfect for your scenario.
Okay. Let's do some more here. What if you have Medicare Advantage and Medicaid? Do I need a supplement? From Richard de Guzman.
No, Richard, if you qualify for Medicaid, then that Medicaid plan that would be best for you would be a Medicare Advantage plan. So we call those dual SNPs. Medicare Advantage, Medicaid, both contribute. So I would not get a supplemental plan because if you're on Medicaid, probably a premium would not be real affordable for you. So I wouldn't do that.
Joanne Kingsley, what is the advantage of using your service versus enrolling on my own?
Okay, well, Joanne, number one, the cost to you is the same. So let's say you went directly with whoever, Aetna, United Healthcare, Mutual of Omaha, doesn't matter. Those premiums that you pay them would be the same premium that you would pay if you go through any broker, us or anybody else. And so the advantage is going versus direct with the insurance company, no one's going to help you. You have a customer service you can call, but you're really no one's client. You just happen to have your supplemental plan with them. So what we do is we have our own customer service team. So when people have a problem, they call us and we can intervene, and we really become their advocate. And it doesn't cost you anything at all to use our services. So that's really the benefit of using a broker. Price is the same, cost is the same, but the service is different. Plus, if you go directly with the carrier and you want to shop rates, they're not going to help you do that. They may tell you what their new rate's going to be, but they're not going to talk about all the other companies. So when you use someone like us, we're going to show you probably 6 to 10 different supplemental options. So I think you just get a much better level of service. And with us, you're not transferred to India or the Philippines or to China. It's right here in America, and so we will help you.
What about Aflac? Aflac is great. We've been helping people do a lot of Aflac.
I think Aflac's going to be a good carrier. I think they'll be long-term stable. They're well recognized. A lot of people are going with them. In some markets, they're not real competitive. Others are very competitive. So we like them.
Guys, for all the people that are asking political questions about if Trump's going to dissolve Medicare, we're not going to address anything political, so it's just there's no point. We'll see what happens.
Yeah.
JB Packa said, I turned 65 September 2024 and registered for Medicare, but I am still working. An employer medical plan is effective. Can I buy a drug supplemental plan and keep my employer plan for basic medical?
You can. Yeah. The qualifications for a drug plan, you have to be enrolled in A or B or both. So if you just have A only, which I'm assuming you do, because if your employer has 20 or more people on the payroll, you would not want B. You would just want A only. So yes, you can still get a drug plan with A only, and then pick up B at a later date.
Can I sign up for Part B and supplemental from overseas?
Yeah, we do have to have, though, a U.S. address. So as long as you have that, you certainly can.
We'd be happy to help you.
Yeah,
We've done it before.
Yeah.
A Raven and the Cat said, so if I am on a Plan G and I'm staying in Plan G, one, if I stay with the same provider, do I need to do anything for next year? No.
Okay.
It just auto-renews for as long as you want it.
Okay.
Two, if I change provider, do I need to medically qualify?
Okay.
Yes.
Yeah, so he means insurance companies.
Yes.
Okay, exactly right. So, yeah, if you're happy with the plan still, it just continues to auto-renew. Remember, supplemental plans are lifetime. The insurance company can never cancel it except for non-payment of premium. You don't have to renew those whatsoever. But you change companies? Yes, you do.
Okay.
Medically qualify.
Chubb supplement went up $20 for 2025. Miss and I will be 66 in February. Should I check for a new plan or just let it ride? Yeah, you could check the tool. Depends. The Chubb rate increase was actually on the lower end of what most carriers did, so you're probably still good to stay there at this point. Okay. Is there a site to do side-by-side comparison? Yeah, go to medicapcompare.com, and you can see difference between G and N across a bunch of different carriers.
Yeah, Medigapcompare.com.
Advantage plans, you have copay and charges when you go to the hospital, right?
That's correct. That's exactly right. So I will say this. Advantage plans do have a couple of services where there's a zero copay. Typically, going to your primary care doctor, basic labs, zero copay. but the majority of services are going to have a copay. And so right now, hospital copays are going to be somewhere between about $300 to $400 a day, up to a certain limit. Some plans, the limit's 5, some it's 6 days, some it's 7 days. But the point is you pay a daily copay up to the limit, and that happens every time you're hospitalized until you've hit your max out of pocket. And so if you did have a copay protection plan, hospital indemnity, they would cover those for you.
If you go from G plan, you got at 65 to an N plan at 67 with the same insurance carrier, do you go through underwriting?
Yes, you do, unless you live in a birthday rule state.
Yeah, and there are some carriers that have some special let you move around. There are.
Really? Okay. Yeah, I know there's some that have done it in the past. I wasn't aware of
There's some
presently.
that currently are.
Okay,
So
my bad.
if you call us, we'd be able to help you with that.
Okay.
Generally speaking, though, you will have to go through underwriting, but sometimes you don't.
Okay.
Will Plan D, wow, we haven't got a lot of D questions. Will Plan D pay the cost of all prescription medication after paying the $2,000 maximum deductible?
They will. Yeah. Once you have spent $2,000 or sometimes even less now because of the true out of pocket, then once the $2,000 is met, then you are done. That Part D plan, and that's why it's important to pick out the right Part D plan. Meaning you want to make sure your medications are covered in the formulary. Because if it's not covered, then that $2,000 cap does not apply. And the $2,000 does not include the premium. That would be in addition to that.
Sean Nugent says, I can retire at 60 with $4,200 a month pension and full medical, wish to take Social Security at 62. Is this a good move? So just taking Social Security early.
Yeah, I think it's fine. I would tell you this. In fact, we just shot a video on this today. The truth is, life expectancy is really what determines that decision. Usually, it makes sense to go to full retirement age. If you're a man and you live to be average age 82, and if you wait to age 67, that is a better move. Now, if you die at 70, then taking it at 62 would be a great move. But if you don't have to have the money, you really don't need that, and there is, you're in good health, and there may be some longevity in your family bloodline, then I think it's always best to wait to full retirement age because you're going to lose 30%. That 30% is for life, and so the break even is usually in about the early 70s. So you live beyond that, it costs you money. And I'm not one that advocates we're going to lose Social Security. I don't think that's going to happen at all. I know it's the trust fund is not as strong as what it should be, it could be, but I think they'll make some adjustments to get that improved here next few years.
Timothy Balsley says, it's been recommended to change your plan to get into a younger group. Can I change from a G United Healthcare plan to the same G plan through United Healthcare?
Yeah. Well, go ahead.
I don't think you can.
Me with that.
United Healthcare will deny that.
Okay.
Yeah.
Go ahead.
Yeah. You'll need to switch carriers. Pretty sure of that. Yeah, they will say this is a duplicate plan and kick it.
Okay.
Yeah.
All right.
That'd be a good idea, though, if you could. I don't think they'll let you. But if you switch carriers maybe for a year, then you can switch back. Yeah. That's probably a way to go about it. Jay Kelty says, I am only 55, but on widow's disability, currently on an Advantage plan. Medicaid pays my premiums. I need to save money. What do you suggest?
I would stay right on your Advantage plan or shop it to make sure you're on the best one for 2025.
Yeah.
That would be fine. Yeah. If Medicaid is covering all that, that's awesome. You wouldn't want to get a supplemental plan in that situation because Medicaid is they would definitely frown on that.
Brenda H says, do you have to medically qualify if you're on an Advantage and go to G?
Yes, you do.
Yep. I mean, unless you're one of those states. There's a couple states like.
Yeah. Oh, yeah. That's right. He's true. There's exceptions to that. If you live in New York, Connecticut, Vermont, then for sure you can move at this time of the year without underwriting. There are certain times you can do so in Maine and Massachusetts, but there's 5 states that kind of have an exception to the rule. But if you don't live in one of those 5 states and you've been on the Advantage plan a year plus, you will have to medically qualify for sure.
Okay, Deborah Bryant says, my husband turned 65, 10/12/25, wants to retire March 25. When does he sign up for Medicare? Well, he'd sign up, July?
Okay. Yeah, well, he's already turned. Yeah.
So turn 65
in
next
2025.
year. Yeah, about a year
once
from
we're in
now,
March
11
25.
months.
Okay, yeah, well, 3 months before. So he can start 10/1/2025, so 9/8/7. So anytime after July 1.
And if you call the phone number scrolling at the bottom of the screen, 833-833-3661, we will be able to schedule an appointment with you out that far, in July.
Exactly right.
So that it's all done. We'll take care of you, hold your hand from A to Z, help you with drug plans, supplement plans, Advantage plan, A and B enrollment, all the paperwork, all the government forms, everything. Make it easy for you.
July 1 on, you'll be in your window to enroll.
Okay, this is a good question. Jerry B says, if I use GoodRx, does this prescription cost get counted against my $2,000 out-of-pocket limit?
No, it doesn't. No, it's only meds that you're running through the plan because the plan is tracking those meds. So if you're using a GoodRx coupon, you're paying cash for that. So it would definitely not apply.
Okay, if I have a Plan G in Texas and move to Illinois and still want Plan G, do I have to qualify for the plan with my pre-existing medical conditions?
No. All supplemental plans are portable, lifetime portable. So when you move from Texas to Illinois, the only thing that can change would be you could see an adjustment in your premium. It could go up a little bit. I doubt it'll go down. Texas a little bit lower than Illinois, but it would be minimal. So they could adjust the premium when you relocate. We've had that happen. I've never had anyone cancel because of that. So take it with you wherever you go.
Dougie says my Advantage plan is being discontinued for next year. Can I switch to a Medigap plan without insurance underwriting?
Absolutely. You got a letter telling you that the plan was canceled and that you qualify to do that. Then that, if we help you with that, then we have to submit that letter along with the application, and that insurance company has to take you.
Carolyn said, Doug East, what is insurance underwriting? Why don't you describe that process? So
Okay.
we keep on throwing around this word,
Sure.
jargon word about
That's good.
underwriting and all that.
Yeah, that's
so
very
what does
good.
it actually take to go from a G to an N or a G to a G?
Right. Well, here's what's going to happen. Underwriting means it's the process of us asking you medical questions and looking at your prescription medications that you take now or have the last at least 24 months. And we take that medical information, health questions, meds, and we give that to the insurance company. And they have somebody on their staff called an underwriter that's going to go through that information to see if they feel like they want to approve your plan or not. And so they're going to ask you questions, checking out your heart, stent implants, heart attack, heart, lung, COPD, emphysema, liver, any kind of course, liver disease, those kinds of things, and kidneys. They're going to ask about cancer. And so there's a series of health concerns that they have. And if you have those things, for instance, let's say you're an insulin-dependent diabetic, they're going to ask you about that. If you're taking too much insulin or you've had any kind of complication, they will deny the application. So you didn't pass underwriting. If you have AFib in your medical records, they will not approve that application. They will deny it. So that underwriting process puts you in a position where they don't have to approve you. And folks, that's why we tell you, if you stay on that Advantage plan long term and you want to get off of it thinking that, hey, I'll switch when I'm 70 and your health changes, you may not be able to make that switch back to original Medicare and get a supplemental plan. So some people roll the dice and they roll the dice too long. It just happens. So you get diagnosed with something serious, you may never be able to get off that Advantage plan.
Okay, Marilyn Bolden says, I'm on straight Medicare and ARP UHC supplemental plan. Per your opinion or recommendation, I'm switching from WellCare to the Cigna RX plan. Somehow, I missed what my pharmacy options are. Don't worry about that. Marilyn, whenever you get your new cards, you're going to get a booklet, and it's going to say what the preferred pharmacies are in your area.
Yeah, but also, okay, that's fine.
Yeah. Okay, Rachel Curtis Cox says, how do I pick a supplemental plan? I go on Medicare this year.
Easiest thing, call us.
Yeah, give us a call. There's a phone number scrolling along the bottom of the screen, 833-833-3661. We would love to help you. We've got people answering the phones now for about another hour. So you can schedule an appointment for tomorrow, or if you want to get it knocked out tonight, you can. But we'll compare the plans. We'll walk you through the whole process. Make sure that you're on A and B. Make sure you're set up with prescription drug coverage, because that's important as well. If not, you're going to get penalized or left without, in a pretty risky position. So we'll walk you through that whole process. But guys, this comment from what was her name? I'm sorry, it disappeared. Rachel? Yeah, Rachel. So this came from within our Facebook group. If you're not in our Facebook group, I highly suggest you go there and check it out. We have 44,000 people inside that group. A bunch of them are clients of ours, as well as just folks just like you that may not be a customer of ours, but are on Medicare or considering going on Medicare. And you can go in that group and you can ask questions. We've got people from our team that are in there answering questions. And usually when I see somebody puts a question, which, there's dozens of them every day, it gets commented on by 15, 20, 30 people just like yourself who are on Medicare or learning about Medicare. So it's not like a sales platform. It's a way that you can interact with people and get real answers to real questions. And so I encourage you, we just put that link in the chat. Tap on that, go and join that Facebook group, and it's a great way to get some education. And then every Monday night, my dad actually goes, he has something he calls Medicare Monday, and at 5 o'clock p.m. Central Time, he will go live and he will teach every Monday on some aspect of Medicare that's important for you to know about. So please go to that Facebook group and join, and we would love to see you inside there, interact with you, answer your questions, and be another way that you can learn. Okay, Rhonda Funderburk says, I'm 64 and currently on husband's group plan and have Medicare Part A only due to a disability. If he retires December 31st, will I need to go on a Medicare Advantage plan because I am in Alabama and not a, that's all I've got.
Okay, well, I think what she's saying is that there is a possibility in most states that you cannot get a supplemental plan if you're on Medicare because of disability. Okay, and Alabama could be one of those states. Most states, you're not eligible for SUPs until you turn 65. So if that's the case, Rhonda, once you hit your 65th birth month, you're going to be in what we call your IEP2. You'll have a chance to then get a supplemental plan, and they can't charge you more than anybody else just because you had disability, and they can't underwrite you either. They have to issue that policy at 65. So once he loses coverage, the Advantage may be your only option. Again, I would call us because we can tell you whether you get one of those in Alabama or not. And I will tell you, there's some states, Kansas is one of them, there are two carriers that you actually can get disability med-sup plans. So as brokers, we can tell you if that would be a possibility in Alabama.
Okay. Chef Boy says, I turn 65 next October. When is the best time to contact you and get plans all set up so I'm good to go October 1st? Thanks.
Okay. September, back it up, September, August, July.
July 1st or after.
July 1 on is your perfect time, Chef Boy.
And if you call us right now, you can schedule an appointment for July. We'd love to help.
Yep. And we'll help you get enrolled in Medicare, too, if that's something that is a need. We do it all the time. Happy to help anyone that's our client enroll into Medicare A and B.
Okay, Michael Raposa says, I'll be 65 in August of next year, but my wife will be 63. What do I do there?
Okay, very good. Well, if you're covered by a group plan, Michael, which I'm assuming you are, I guess you're still working, what can happen is if you do decide to go on Medicare and retire, then you can, your wife would be eligible, if you time it right, your wife would be eligible for COBRA for 36 months. And again, we'd have to coach you on how to do that because usually COBRA is just 18 months. But if you go on Medicare at the right time, then her COBRA can go to 36 months, which she only needs it for 24 months anyways. So if you keep working, though, and you have a good group plan, then she'll just be covered by that plan.
Okay, Joe K says, if I want to change my F plan, can I? And what types of pre-existing conditions will prevent me from changing? So go to that Medigap compare, and you can actually choose a plan, and then you will see all of the health questions. So you can go to Medigap compare, put in your info, choose a plan, and then you'll see the health questions.
Yeah.
Okay. Let's see. Boy. I'm currently on Cigna Saver drug plan. I'm considering the SilverScript Smart Saver. Only have 5 prescriptions. Your thoughts about... I can't really tell you if you should stay or move, but I can tell you every Monday to Thursday I go live at 1 p.m. Central Time, and I will give you a drug plan recommendation.
Yeah, but I don't think SilverScript Smart Saver is even an option
it's
in
going away?
2025.
Okay.
I think Aetna has only one plan.
Okay.
Yeah,
Might be the case.
and I could be wrong about that, but I thought it was gone. I know we had it this year in 2024, but I don't think it's an option. I have not seen it. I think they only have their SilverScript Choice plan for 2025. Okay. But do what Josh said. I mean, he teaches this every week on how to shop.
Every day, Monday to Thursday.
I mean, yeah, I'm saying you're done for this week. Yeah.
Okay, if your F plan goes up, when you get notice in 25, can you then change plans, or are you required to do so before December 7th?
Great question. No, Medicare Supplemental Plans are not bound to this open enrollment season. You can change a Medicare Supplemental Plan anytime you want, again, subject to approval if you have to go through underwriting. but it has nothing to do with these dates whatsoever. They can be switched anytime.
Any idea when the official 2025 IRMA rates will be announced?
We keep checking every day, usually a couple times a day. We have no idea.
But if you subscribe to this YouTube channel, hit the little subscribe button and ring that little bell, hit the little bell button, you will get a notification when we drop the video on that.
Yeah. Hopefully soon.
What are your thoughts on choosing Aflac Plan G? Love it.
Yeah, I think great plan, great company.
How do I find a reasonable standalone D drug plan in New York, and how do you get paid? How many D plans do you know about? We know about a lot of D plans. We're probably not going to get paid on a D plan, though, recommendation. If so, it's maybe a few dollars.
Yeah.
But you can go to Medicare.gov. You can go to our site, which is MedicareSchoolEnroll.com, and compare drug plans. You can call in and ask for the live stream link. Actually, can we drop the live stream link in the chat? It's that Vimeo link. We're going to drop a link in the chat, guys, and if you save this link every Monday, Tuesday, Wednesday, and Thursday at 1 o'clock p.m. Central Time, I will show you how to find a drug plan, and I'll do it for free, and I'll even make a drug plan recommendation if you give me your medications and your zip code and pharmacy. So we're going to drop this link in the chat. You guys can click this. I know we're giving you a lot of links. Hopefully you can just open them up in other tabs, but we have a lot of different ways you can learn. And so love to help you with drug plans if I can, Weedman Law. Would you explain IRMA?
Okay, well, IRMA is an acronym that stands for Income Related Monthly Adjustment Amount. So when we do go on Medicare, A and B, the B premium that we pay is based upon our modified adjusted gross income, MAGI, and that is very simple. Modified adjusted gross is line 11 on your tax return, which is AGI, plus line 2A. 2A is tax exempt interest, typically municipal bonds. And so they take line 11 plus line 2A, and that becomes your modified adjusted gross income. And that number then from the IRS goes to Medicare to establish your Part B premium. And so we have thresholds that are established. So for a single filer this year, it's going to be different in 2025. But right now, if you're a single filer on Medicare and you make $103,000 modified adjusted gross income or less, you pay what we call the base premium of Medicare. This year, that's $174.70 a month. If you're married who file a joint return, that threshold is $206,000. So single below 103, married below 206. So we're below the thresholds, you don't have to pay an IRMA. But if we're above those thresholds, then we have IRMAs. There's actually 5 different levels of IRMAs. You can call those like marginal tax brackets. 5 different levels. So the higher your modified adjusted gross income, the more that you're going to pay in IRMA. And when we have an IRMA, we have 2 types of IRMA. We have an IRMA on the B of Medicare, so it's added to that $174.70, or we have an IRMA, and we have an IRMA on the drug side. And so they're not real large, but when we have a drug plan, then they add that additional surcharge to that as well. So IRMAs are surcharge for those that are considered to be high income by Medicare standards. That's the IRMA.
William Gregg says, I was told I would get a free pair of glasses or even contacts after a cataract surgery if needed, and it's not using the vision perk benefits from my Advantage plan.
Okay. All right. Well, after cataract surgery, you're eligible for a pair of glasses for sure. And I guess contacts, I wasn't aware of that, but for sure glasses. So it's not using the vision. Yeah, and I would agree with that because that's something that, of course, your Advantage plan is replacing original Medicare. So I think the perks on the Advantage plan, they're going to give you. I looked at one today. I think it was $200 for eyewear. So I would think it would be $200 in addition to that because it's part of original Medicare. They have to match that benefit. So I don't think it should come out of your perks benefit on the Advantage plan. I would agree with that. So I still don't understand your question. I guess it's just a statement.
Do many people, Robo Brio says, do many people become state residents offering lower price plans and live in another state? An example, South Dakota residency, but live 75% of the time in Washington state.
Yeah, well, not legally, because what we have to do is wherever you live 6 months and 1 day would be your residence. Now, I mean, so that's the way I would do business. I do know that we've had people that use South Dakota because they were full-time RVers. and then they had a physical address in South Dakota that they actually use. But if you spend 75% in Washington and you have an address there and you get mail there, then that's really where your MedSup premium should be based.
Am I understanding this correct? If I have Medicare, I cannot use the GoodRx, et cetera, coupons for prescriptions, and do you know why? No, that's not the right understanding. So if you're on Medicare, you absolutely can use GoodRx coupons. But what you pick up in purchase using a GoodRx coupon will not go towards that $2,000 max.
Exactly right. Yeah,
Right? So you wouldn't want to use a GoodRx coupon to save like $1 or $2, right? Especially if you're on some expensive meds and you're going to end up hitting that max. Because they won't be applied towards.
That's right. Yeah, if you're on real expensive meds, the GoodRx coupons are not going to help you. If you're on cheap meds, then it's fine to go ahead and use a GoodRx if that's cheaper than the plan. And most people are not going to hit that 2,000.
Now I'm seeing, yeah, if you're on,
I said
if you're on a brand,
Yeah.
you're going to hit it,
Yeah.
almost assuredly.
Yeah.
If you're on insulin, many times you're going to hit it.
Okay.
Yeah, I've run
Yeah.
hundreds of these this month.
Yeah.
Okay, can you please explain how, when you have a doctor's visit, how a supplemental plan in works?
Okay, you can. So Supplemental Plan in has a copay to see a doctor up to $20. So depending upon what is the level of that service, you may get a copay bill of $16, $18, $20, but never more than $20 every time you see a doctor. So you have to meet your B deductible, and then in addition you have the copays to the doctor. The wording is up to 20. Could be less, but could never be more.
Lee Rundle says, which supplemental providers are the most stable? I don't know that we can actually mention names on here.
Yeah, this is more of an educational event, so that's why we have to be very cautious about mentioning companies. Call us, please, Lee.
Yeah.
All of our agents have all the data on the carriers in your market. We can tell you who's been the most stable, and it does vary.
If I move outside the USA, should I still pay for my Part B and G? Can I get back on a supplemental plan if I move back to the USA?
Okay. Well, it just depends on how long you're going to be gone. And where you're going, are they going to have some type of insurance that is considered to be credible? So that's kind of a loaded question. Without knowing for sure where you're going, that is going to vary. As a general rule, what we tell people, if you're going to be gone long term, I wouldn't keep my supplemental plan in place. But if short term, for me, 2-3 years or so, I would probably still keep that plan. I would, because if that B continues on and you don't have the G, you get back in the States, now you're going to have to medically qualify to pick up that G plan. Yeah, if a person were to be able to drop their B, then they could reset that, and then you wouldn't have to qualify. But if the B continues on, that supplemental plan that you want to pick up at a later date, you would have to medically qualify.
Brian S. says, a couple of years away, but doing my research early. If I turn 65 in January and my wife turns 65 in August, should I just keep us both on my employer insurance until I turn 66?
Yeah, I think if the employer plan is a good one, then I think that's a real good choice. If it's lousy, then no. But if it's good,
And maybe it's just, you don't have to wait till you're 66. You could just both start in August.
yeah, when she turns 65.
Yeah. Okay, Karen S. said, I missed where to go to compare supplement plans. We'll drop that. We'll put that up here again, medigapcompare.com, medigapcompare.com. Write that down. Go to it after this live stream is over. Okay. If you have Part G and move from New York to South Carolina, do you continue to pay the New York premium rate, or is it updated based upon where you live now?
Okay, well, it can vary carrier to carrier, but as a general rule, when you've relocated, go to South Carolina, then your rate should go down. Okay, I can't speak for every carrier because some have some different rules, but usually you've relocated, you've done a change of address, you've notified them that you're moving, then typically that premium will go down.
Betsy Sears says, I know with an employer plan, the plan rolls over unless you change it. Is that the same with Medicare, or do you have to select every year?
Yeah, it will roll over year to year.
Unless you get a notice the plan is somehow being discontinued.
Right,
Which
yeah.
it has happened this year, actually.
But supplemental plans continue to roll over, drug plans continue to roll over, Advantage plans, that's what Josh was saying, maybe not.
Kathy still says, when and how should I be able to find out how much my Aetna supplemental plan premium will increase for 2025? So it's probably not going to go up January 1st. It might be tied to your policy anniversary.
Yeah.
So 12 months after you bought it, or maybe your
Aetna is.
Yeah, is this-
Yeah,
okay.
Aetna's going to be tied to your policy effective date. So if you started in August 1, then 30 to 60 days prior to that, you will be notified.
But after that, it can move. I mean, it depends on how. Yeah, it depends on how long they've had it. Then it will go up with everyone else.
Yeah.
Okay.
But I'm saying as a general rule, the increases we see from Aetna are usually at effective date of the policy.
Cheryl Blevin says, I have all my policies through y'all since July 1st. The only thing I need to change is my drug plan from WellCare. Corey is listed as my broker on the website. Should I just go ahead and pick a new plan? Absolutely.
Yeah.
Corey's a wonderful person.
Yeah. And she's saying, go ahead and pick a new plan. So through our
Yes.
site.
Yeah. Yep. Let's see. If your supplemental plan quits and you are forced to get a new G plan, will you have to do the underwrite even though you've always done everything right? Well,
No.
I've never even heard of a supplemental plan.
I've never seen it in my lifetime.
Usually they just get bought out by another carrier who then continues to service it. I've never.
Yeah, but let's say it did happen.
Yeah.
If it did happen, then there will be a window of time where every supplemental company that offers plans in your state, your area, would have to take these people who lost their plans. It's usually about, it would be, not usually, it would be probably a 60-day window. But we've never seen it happen since we've been in this business, so I doubt it's going to. But if it did, that's the way it would work. You'd have guaranteed issue for that period of time, and you can move from your G plan from ABC Insurance Company to XYZ that's still in business.
Okay. Only Advantage plans must be renewed each year. Original Medicare with supplement plans obtained at 65 could be kept for life. That's right. Ilya Godzin says, does it make sense to apply for ARP supplement plan? Sure.
Yeah.
ARP supplement's a great one.
Yeah, but remember this, please. It's United Healthcare's the insurance company.
Yeah.
AARP endorses United Healthcare plans, but ARP is not an insurance company. They just endorse the product, get a royalty for it. But good option. Good
Okay.
option.
P. Hall says, did I understand you to say you can get a supplement plan with an MA plan?
No, can't. It's illegal to do that. What you can do with an MA plan is you can get a Coopey Protection plan that comes alongside and covers your hospital copays, and usually they have a lump sum cancer payment if you happen to get cancer. So you could call that a supplemental plan, but supplemental plans are supplementing original Medicare. Copay protection plans are helping you with your out-of-pocket expenses on the MA plan.
Is Aflac Plan G too new to consider? No, no, it's not. It's backed, I think, by Aetna. I'm not sure if we're supposed to say that out loud. But it's and Aflac's just a huge carrier, so you're fine.
Yeah, I would not. A lot of people are going with them. I think they'll be solid and stable. So I think you'd be in good hands. If they're competitive in your market, I'd do it.
Part A deductible could be paid up to 6 times a year. What does that mean?
Yeah, and it's true. The reason for that is the Part A deductible is not annual. It's tied to what we call a benefit period. And a benefit period works this way. When you're hospitalized, you begin a benefit period. When you're discharged, let's say 7 days later, once we're discharged, now I am in this benefit period for another 60 days, which means that if I happen to be re-hospitalized during that 60 days of being discharged, if I go back to the hospital, I'm still in the benefit period, therefore covered by the same deductible. So if someone's hospitalized, discharged, 60 days goes by, and nothing happens to them but happens after that, then they go back to the hospital, and they could pay another deductible. So 6 would be really, really extreme. But is it possible? Yes. Highly unlikely.
Okay, Carlos Vladimir says, do Medicare Medicaid plans, also called dual plans, require pre-authorization like Medicare Advantage plans? Yes.
Yeah, you're right. Yeah. All the Advantage plans, dual plans included.
Blue Eyes says, does Aflac have a prescription program as well as medical?
No. They write supplemental plans only.
Just arrived. How can I contact you? There's an 800 number scrolling at the bottom of the screen, 833-833-661. Call
And
us,
it's, we're on Central Time here, 7 to 7, Monday to Thursday, 7 to 6 on Friday. We'd love to help you.
Wendy says, if I'm working past 65 with a large employer, I don't have to file for Medicare Part A. I want to continue with my HSA until I retire.
Good job. That's good. But remember this, Wendy, let's say you're going to work 2 more years. When you have decided you set a retirement date and you enroll into Medicare, from that enrollment date, they're going to backdate your A date 6 months. So you need to stop those contributions about 6 months prior to making this decision to enroll into Medicare. They backdate a date. When they backdate it, they never go, before 65, but they backdate 6 months or to 65, whatever is the soonest. So you don't want to over contribute to your HSA. Now, if you're only putting in a little bit of money, $100 a month or something, it's not a big deal. But if you're maxing out, you definitely got to pay attention to the backdating of the Medicare Part A.
I'm working with Josh Roof, nice guy.
And my son-in-law, his brother-in-law.
That's why I put it up there for you.
Oh, you did?
Okay.
Okay.
Are you still working on new D plans for those of us who currently have WellCare? Yes, we got it all, I think, together today. And so we should have those out Friday or Monday. And I know you guys have been waiting for like 2 weeks on this. But we finally, I think, got it all done. It was a lot. There was like thousands and thousands and thousands of you that signed up for this. So we've been working on that. If you don't know what I'm talking about, don't worry about it. If I enroll in a Sup G in one state and later move to another state, will I need to go through medical underwriting, or can I continue with the current plan and keep paying those premiums?
No, you can just keep paying the premiums. The insurance company cannot cancel because of age, medical conditions, or location. That is a total portable policy. It's yours for the rest of your life. Just pay the premium. That's it.
And Core Knight says, is it better to go with a nonprofit insurance company for a supplement plan, example Horizon Blue Cross, versus regular, example Chubb, to minimize yearly increases? This is for New Jersey.
Yeah, I don't believe so whatsoever. Yeah.
We write a lot of business with Blue Cross, and they have had, I don't want to disparage any insurance carrier. Let's just leave it at that. It's probably not.
Yeah.
Just started Medicare, have a supplemental plan. What happens with a pre-existing condition when you're just starting?
Okay, if you are new to Medicare, then all your pre-existing conditions are going to be covered. If you're not new to Medicare and you didn't have insurance and you get a supplemental plan, a different supplemental plan, a new one I should say, then those pre-existing conditions in some states are not covered for 3 months, some states 6 months. But it is very rare. Here's the point: if you've been insured either on another supplemental plan or through a work plan, your pre-existing conditions will be covered. It's uninsured people that have that concern about pre-existing conditions. Okay. And in your case, Ronald, they're covered because you say so. You just started Medicare, have a supplemental plan because you just started. You should not have any issues whatsoever.
Is it true Cigna is leaving Medicare plans?
No. What's true is that Cigna is probably going to be purchased by another insurance company called HCSC. That is just an offer on the table. They're trying to buy Cigna for $3 billion. And if that gets approved by the government, then that company is buying Cigna. But Cigna, that name was going to continue, to exist. And so I wouldn't really be worried about that. I can't see any reason that that's going to be anything detrimental.
Okay, Mela Ashok says, hi, as always, you guys do a great job. My question is this live chat available on YouTube later? Great Q&A, and I keep missing it because of work. It is available. You can read through all the comments. You can also join our Facebook group and ask comments or post your questions in there, and we'd be happy to answer them. Let's see. Louisiana's a birthday rule state. What is a birthday rule?
Okay. Birthday rule means that you have the right to move your supplemental plan. And in Louisiana, I think the rules are, because they're a new birthday rule state, I'm pretty sure in Louisiana, you have to keep the same carrier. Some birthday rule states, you can actually change carriers. So in Louisiana, let's say you're on a G plan, you can usually move from a G plan to like an N plan with no underwriting. You just have to stay with the same carrier, and that would be a G to G as well. So it means like to like, so I'm switching like to like or like to less, G to G, G to N, with no underwriting, and that's going to be tied. The birthday rule, usually it's about a 60-day period of time, which typically starts on your birthday, goes for the next 60 days, or it could be 30 days before birthday, 60 days after. But that's that window where you can change plans like to less with no medical underwriting. And there's 12 of those states, and Louisiana is one of them. And I'm pretty sure you got to stay the same carrier with them. I know Illinois you have to, and that's only 65 to 75.
Okay, Jody Tanner Thatcher says, I have been in remission for 2 years from lymphoma. Can I change from Advantage to Plan G?
Okay, well, with lymphoma, normally it's a 3-year look back. There may be a carrier that has a 2-year look back. And so if you've been cancer-free and treatment-free from cancer for 36 months is usually, but if you want to call in, we can find out. There may be a carrier that just looks back for 24 months, but normally on cancer, it's 36 to 60 months look back.
Beverly Christian says, I'm just starting out 65 and will have A and B plan, but what supplemental plan with no cost would be good? Well, you're probably talking about an Advantage plan if you're looking for something that has no cost. Give us a call. Phone number is scrolling at the bottom of the screen, 833-833-3661. We would love to help you. I feel like I'm running like a radio show or something. Okay, Audrey Smith Von Quintus says, what does a formulary mean? So a formulary would be associated with a drug plan, a Part D plan. And a formulary is a list of medications that a drug plan covers. So it's just a list. And the differences between all these drug plans out here, the biggest difference is what prescriptions are on that formulary, what drugs they're covering, because each plan's looking for a slightly different mix. Okay, Frank Rizzio, I have VA healthcare. If I use an MA only plan, how is the Part B reimbursement decided? Does it vary year to year?
Yeah, it can vary year to year. And what happens is if you're on Social Security, that Part B reimbursement is credited to your Social Security check. If you're not yet on Social Security and have an MA only plan, then you're getting a direct bill from Medicare, so that bill would go down by that reimbursement amount.
Oh, this is a great question. TBW says, turned 65 on 8/20 and enrolled in Advantage plan for the remainder of 2024. I am in a special window that will allow me to go to a Plan G without underwriting. Mm-hmm. Just explain the OVP.
Okay. Well, but 8/20/24. So she just started this. Are we talking about the same thing?
Yeah.
Okay.
Yeah. So
exactly right. So
is she in a special window?
Yeah,
Yes.
you are. Okay. So let me just write out. So August, September, October, November, December, January. So yeah, you're still within your original what we call Medigap OEP. So you're within that 6 months. So really, anytime right now. But definitely that 6 months would be over in January. So you'll still be in that OEP, so that if we submit an application for a G plan, there'll be no underwriting at all. That insurance company will approve it immediately because they have to.
Yeah, just call us. We would be happy to help you with that. Okay, Mary Howell says, the 2 drug plans I've looked at have a $590 deductible in addition to the $2,000. You keep saying that after paying the $2,000, there are no more costs.
And that's true. And in that $2,000, the deductible is included. Okay, so the only thing not included in this $2,000 would be your premium on the plan. So that $590 deductible is part of the $2,000. So once you have spent out of your pocket $2,000, your drugs will be zero for the rest of the year. And remember, they do have a plan now. If meeting that $2,000 is challenging, you can enroll into what's called the Medicare prescription payment plan. And every drug plan, you can enroll in that. And then what happens is once you enroll in the plan, you don't even pay for your meds at the pharmacy. Your plan will actually bill you for those on a monthly basis. So it allows you to spread that $2,000 obligation out throughout the year. And I have a video on that too, because it is kind of a complicated way they bill you. But
Beverly Ross says, question, I use this Josh info for Part D, but didn't change ages to Josh or Marvin. Does it matter I left it under Shannon? No, Beverly Ross, you're fine. We just found out my husband's Plan F premium went from 143 to 180. Birthday rule state. Could he switch to G without underwriting? If so, it would be a good idea. Chronic health issues.
Okay, some states are just like to like, so that would be F to F. But most of the birthday rule states are like to less, so F to G would be a possibility. I've never heard of people going from an F to an N on a birthday rule, but maybe you could. I don't know. Yeah, but the answer is if you really are in a birthday rule state, you're going to be fine because that's the whole purpose of it. Around your birthday, regardless of health conditions, you can make that move.
Okay, still, H2O says, can you apply for Social Security and Medicare at the same time?
Absolutely. You sure can. Now remember, when you apply for Social Security, you would not apply for it any more than 4 months prior to when you want to start your benefits. And then when you did that 4 months in advance, then they would also ask you about Medicare, and you can let them know that you want to do your Medicare A and B as well. And that's on the application. If it's just Medicare alone, it's 3 months in advance. But with Social Security, it can be 4.
Okay, everybody, we've been here for 90 minutes. That's how long we are going to be able to stay tonight. I'm going to leave you guys with a couple of links. But first, write out our phone number. If we can assist you, call our phone number. We've got team members here still for another 30 minutes tonight, and then we'll be back in tomorrow morning at 7 a.m. Central Time. Okay, 833-833-3661. We would love to help you. If you're on a supplement plan and you want to compare plans, you can go to Medigap Compare. Medigap Compare, write that down. We would love to help you there. And then the last thing I'm going to do is tell you, if you want, you can go to our Facebook group. Type in Medicare School in your Facebook search, and you will see our Facebook group. Join that, and you can ask questions, and we would love to see you inside there as well.
And every Monday at 5 o'clock, I have a session with our Facebook group, and then every Thursday, we do this kind of event as well. So we're here to help you.
Thanks,
and
guys.
We'd love to serve as your broker.
Take care.